Hello everyone, I am Anagha Joshi and this presentation, Making CSE Work in Mozambique, a Realist Lens for Effective Implementation, draws from my graduate research completed under the supervision of Dr. Nazim Mohajereen. So I will briefly introduce myself and then move into the background before we get to the main findings and recommendations. My work sits at the intersection of public health, education, and community engagement. Over the years, I've had the privilege of working with schools, NGOs, and various outreach programs. My role has involved both delivering and training others to deliver comprehensive sexuality education in a range of settings, from typical classrooms all the way to youth correctional facilities. Those experiences, combined with my background in maternal and child health research, have taught me a fundamental truth. Successful implementation is less about the perfect plan on paper and far more about how it genuinely connects with people and their lived realities. I will start with a bit of background to set the context for this presentation. Around the world, adolescents are navigating increasingly complex social and digital environments. Yet access to reliable, rights-based sexual and reproductive health information remains deeply inequitable. Comprehensive Sexuality Education, or CSE, equips young people to make informed decisions, build healthy relationships, and claim their rights. It is widely recognized for improving adolescent health outcomes. Mozambique's CSE efforts trace back to Programa Geração Biz, launched in 1999, which is a multi-sectoral, youth-centered model that provided CSE both in and out of schools. The current national program builds on that foundation, with the Ministry of Education leading implementation alongside partners such as UNFPA, academic institutions, and local NGOs. Yet, implementation often faces political and cultural resistance. In Mozambique, nearly half of girls marry before 18 and a third become mothers before 20, even as the country has adopted progressive CSE policies. The challenge is not the absence of policy or curriculum. It is implementing CSE effectively within the realities of each school and community. On the ground, the picture is mixed. There is clear progress, stronger political commitment, closer alignment with the Sustainable Development Goals, and creative use of digital tools like SMS platforms and mobile apps to reach young people beyond the classroom. Yet, deep challenges remain. Social resistance, shaped by gender norms and cultural taboos, still limits how openly CSE can be taught. Language adds another layer. While Portuguese is the official language of instruction, many students and teachers rely on local languages when discussing sensitive topics. That gap creates differences in understanding and delivery. These issues are compounded by weak coordination across institutions, limited teacher preparation, chronic underfunding, and fragile monitoring systems. The result is a patchwork of success. CSE works well in some schools for some students under certain conditions, but struggles to take root more broadly. My research explored this variation using evidence on CSE implementation from Mozambique. When we think of CSE, it is tempting to see it as a just curriculum or a subject. But in reality, it is what we call a complex intervention. It has multiple components, reaches across systems, and behaves differently in different environments. That's why one-size-fits-all solutions don't work. Given this wide range of factors, I explored why CSE succeeds in some settings and falters in others, using a realist approach that views it as a complex, interconnected system rather than a simple intervention. Before we move into the results and recommendations, I will briefly outline how this work was done, just enough to show where the insights come from. The study asked one central question: how, for whom, and under what circumstances comprehensive sexuality education programs in Mozambican schools are successfully or unsuccessfully implemented. To answer that, I used realist synthesis methodology. I reviewed 1,515 articles that included peer-reviewed research, as well as grey literature, and identified 33 relevant pieces on implementation of CSE in Mozambique. From those, I refined a set of initial program theories, which in a nutshell are early assumptions of how CSE might succeed depending on the context, the mechanisms it activates, and the outcomes that follow. After several rounds of refinement, 10 refined program theories emerged. Together, they form an actionable framework, which provides a way to design and evaluate CSE that fits local realities instead of importing models from elsewhere. What I'll share next is a list of all 10 program theories, just so you can see what aspects of CSE implementation were studied in my research. I have explored each of these refinements in depth in the thesis. In this presentation, we will look at them through a practical lens and translate those insights into recommended actions for implementation. This slide maps out the 4 levels that influence how CSE is implemented: national, institutional, community, and individual. Each level plays a role. National policy sets the direction, institutions manage delivery, communities shape acceptance, and individuals make it real in classrooms. It is important to note here that these levels don't work separately. They are connected through cross-level interactions where actions in one layer affect the others. Paying attention to these connections allows implementation to work in sync across all levels. The recommendations I will share in the next slides are not generic best practices. They are drawn directly from how these 10 program theories played out across contexts and patterns that explain why CSE in some schools succeeded under the same policy conditions where others struggled. Think of them as switches. Each one activates a different response depending on your context. First, let's look at these 3 broad lessons that apply across all contexts. Start with your context. Before implementing, ask what are the local values, languages, and institutional constraints here. The same strategy that works in Maputo may fail in Tete, not because it is bad, but because it doesn't fit the local context. Focus on mechanisms, not activities or resources. Ask what kind of response you are aiming to spark in people. Is it trust, legitimacy, teacher confidence? The same training session or resource can produce very different outcomes depending on which mechanism it sets in motion. And lastly, keep it adaptive. Implementation is not one event, it is a cycle, and the programs which constantly learn, reflect, and adjust are more likely to succeed. Moving into the recommendations, these are organized across the 4 system levels we discussed earlier, that is, individual, institutional, community, and national. This mirrors how CSE works in practice. Progress at one level depends on support from the others. We will start with the classroom and individual level, then move upward through schools and communities, and finally to policy level. The first recommendation at this level is CSE is most effective when it feels culturally familiar and emotionally safe. Adapting content to local languages, examples, and expressions isn't just a matter of translation. It activates what we call the mechanism of cultural resonance. When students see their own lives and values reflected in lessons, they respond with recognition and trust, which reduces discomfort and makes open discussion around sensitive topics possible. The second recommendation is about how learning takes place. When teachers shift from lecture-based instruction to interactive methods like role plays and group discussions, it triggers mechanisms like agency, curiosity, and sense of shared ownership among students. These approaches invite students to think critically, voice opinions, and learn from one another rather than simply memorize information. The third recommendation at this level is to create physical and digital safe spaces. This is not just about infrastructure, but about generating a sense of psychological safety, a mechanism that determines whether students actually interact with the intervention resources without hesitation. Establishing cantinos, small corners in schools where students can talk about CSE, ask questions, and access SRH services discreetly helps normalize these conversations within the school environment. Similarly, using digital platforms that allow anonymity and confidentiality gives students the freedom to ask questions without fear of judgment or social repercussions. What these approaches do is activate trust and emotional security, invisible but essential conditions that make learning and help seeking possible. The second level is institutional or school level. This is important because good policies succeed or fail depending on how they are put into practice. The first recommendation at the institutional level is to invest in ongoing teacher training. One-off workshops rarely change practice. What makes the difference is continuous mentorship and peer learning, which allow teachers to build both skill and self-reflection over time. The underlying mechanism here is self-efficacy. As teachers feel more capable and supported, they begin to see CSE as part of their professional role, not an added task. The second recommendation is to use existing school structures and resources. Embedding CSE content into subjects like life skills, natural sciences, or citizenship education helps normalize it within the curriculum and reduces resistance from parents or administrators. The mechanism this activates is legitimacy. When CSE is framed as part of the standard learning process, it gains social and institutional acceptance, making implementation smoother and more sustainable. The third recommendation is to establish two-way referral systems between schools and health services. When schools can confidently refer students to trusted, adolescent-friendly clinics, and those clinics recognize the school as a legitimate partner, it builds continuity of care. This linkage activates two key mechanisms: perceived support and institutional legitimacy. Students begin to see sexual and reproductive health services as accessible and trustworthy, while teachers and health workers view each other's roles as complementary rather than separate. In practice, this connection strengthens both systems, making CSE not just a classroom subject, but part of a broader, coordinated effort towards healthy adolescence. The next level is the community. Schools operate within a wider social ecosystem, and community dynamics and opinions strongly shape what happens inside classrooms. The first recommendation is to engage religious and community leaders from the start. Open dialogue from the beginning allows CSE to be framed in ways that connect with existing community values and priorities. The mechanism at play is social legitimacy. When trusted local figures acknowledge or support CSE, it gains credibility and acceptance within the community. The second recommendation is to involve parents and elders in the design and delivery of CSE. Co-creation builds ownership and trust, turning potential resistance into support. When communities feel that their perspectives are valued, they move from being gatekeepers to active stewards of implementation. The third recommendation is to empower youth voices. Youth-led initiatives such as peer educators and student clubs create spaces where young people learn from one another. When students see their peers leading CSE discussions, it signals acceptance and normalcy, encouraging broader participation and genuine engagement. The final level is the national and policy level. For CSE to be both effective and sustainable, strong policies must support and reinforce what happens in schools and communities. Sustainability of CSE programs depends on alignment between policy and practice. The first recommendation is to strengthen coordination across sectors. Education, health, and youth ministries should plan and implement CSE together, not in silos. When efforts are aligned, programs support each other instead of overlapping or competing. The roles and responsibilities are clear, which makes implementation smoother and the resources are used more effectively. The second recommendation is to build both formal and informal feedback loops within the system. Implementation improves when information moves freely and people feel heard and valued. For example, when teachers, schools, and communities can share what's working and what's not. Creating spaces for that kind of reflection and learning helps policies stay responsive to what's happening on the ground and promotes positive changes in implementation. The third recommendation at the national level is to advocate for comprehensive policy reform in contexts where current sex education policies are still restrictive. Expanding the range of topics and allowing deeper content coverage gives schools the space to address the real experiences and questions young people bring into the classroom. This works because when CSE is clearly backed at the national level, it reduces controversy. It also supports curriculum development and gives teachers the confidence to teach openly. The last recommendation is to, over the time, strengthen national ownership in places where relying too much on donors has created gaps or overlaps in implementation. Investing directly through government systems and ensuring resources are shared fairly across regions helps build one clear national direction for CSE. This approach builds trust in institutions and makes programs more stable over time. This also presents CSE as a nationally supported effort and not a temporary donor-led project. To close, a few key takeaways tie everything together. First, cross-sector coordination is critical. Comprehensive sexuality education only works when education, health, and community systems move in the same direction. Second, focus on the why. Understanding what truly drives change is as important as the activities themselves. Third, local context matters. Every setting brings its own unique realities, and success depends on how well programs adapt to them. And finally, all levels of the system must be engaged. Sustainable implementation happens when individuals, classrooms, communities, and national policies work in sync. When these pieces align, implementation success becomes far more likely, and the chance of long-term sustainability increases significantly. Thanks so much for taking the time to listen. I hope some of these insights resonate with your experiences and offer a few useful insights to think about implementation. In the next slide, there are a few questions to initiate group discussion. Since this is a recorded session, I look forward to meeting everyone in person soon and hearing how these findings connect with your experiences on the ground.